Hello, hello, and welcome in, you guys. I'm your host, Andrea, with From Mrs. to Ms. I'm being joined today by Dr. Paul Gittens. Paul, how are you?
I am wonderful. How are you doing out in
I'm good.
California?
I know, I love it. We were just talking about the difference between where you are on the East Coast and where I am on the West Coast. And the only difference right now is the cost of living here compared to there, but the weather here is beautiful. What do you have, snow there right now?
Oh no, we had a major thunder hail storm just yesterday, and as you know,
Oh my gosh.
we were talking about my different offices, and I was in my New York office, my Manhattan office, and I take the train to and from Philadelphia, which is where my other office is, and
Uh-huh.
like all the trains were delayed. It's flooding, and it was a mess,
It
but we
kind
made it. And like I
of
said, I'm gonna have to move to. I'm thinking I'm gonna have to move out to California eventually.
I know. Don't do it. Don't do it. Just visit. You can come visit. Well, let me tell you guys a little bit about Dr. Gittens. He is a nationally recognized expert in sexual medicine, hormone replacement, and male infertility. He is a board certified urologist and clinical associate professor. He founded the Rockwell Centers for Sexual Medicine and Wellness in Philadelphia, New York, and Lehigh Valley to provide discreet expert care for patients facing sexual health concerns. With a specialized background in sexual dysfunction, low testosterone, Peyronie's disease, and female sexual health, Dr. Gittens takes a compassionate, personalized approach to treatment. He is also one of the few physicians using the Mona Lisa touch laser for vaginal atrophy with great success. He's dedicated to breaking the stigma around sexual health. He empowers patients to regain confidence and improve their overall well-being. I love that. And I'm excited to talk to you because, as I said, I really haven't delved into this topic much. I tend to gear a little bit towards the women. So I love that we're going to gear towards the men. And I love that you talk about how there is this stigma around talking about it,
Of
right?
course, it's amazing, especially in this country where sex and sexual kind of things are around us all the time
Yeah.
on TV. It's on billboards.
And it's
It's
like taboo.
and we can't talk about it. We just cannot talk about it. And my practice, as I mentioned, we treat men, we treat women
Mhm.
for any type of sexual dysfunction for the most part, and hormonal
Mhm.
therapy. And it's a place where people can come and really kind of discuss these issues.
Mhm.
I've had patients. Actually, I had a patient today that said, this has been going on for such a long time, and
Yeah.
I haven't even told my partner about it, because I've just been avoiding my partner because, I just don't know where to start.
Yeah.
And I was so we started, and by the end of the conversation, he just felt much better.
I love that. And I would think that that is the majority of the people that are afraid to talk about it, afraid to talk with their partner about it. It can be embarrassing and it's uncomfortable and you're in a very vulnerable position. But if you want to get past the issue and work on it together, then this is a great resource to be able to come to someone like you that can help them do that. I love that.
Yeah, I
Yeah.
hope so.
I hope so. So let's start at the beginning. So, what led you to specialize in sexual medicine, hormone replacement, and male infertility? Was there a defining moment or an experience that inspired you to focus on this field?
Well, I mean, just in medicine in general, my mom was a nurse.
Hmm.
Parents are immigrants. My mom was a nurse. She was born and raised in Jamaica. She went to England and she got her nursing degree. She came to the United States, and she just had this love for medicine. She just had
Mm.
this, and I remember sometimes going to the hospital with her and just like going through the hallways, and they looked so big at the time, and
Yeah.
just knowing my mom was like this hero of like helping people. So I would say
Oh,
like that whole thing kind of started then.
yeah.
And from there, I obviously went to med school, and through med school, you go through a lot of different rotations and you try to figure out what you want to do. And I
Yeah.
decided on urology. So urology is a field where, we deal with men and women on intimate levels. We deal with a number of things for men: prostate cancer, kidney stones. We do for pelvic health for women. And so I love
Hmm.
that. I didn't love the prostate cancer end of it, the cancer end of it, but I loved like
Yeah.
the kind of dealing with people on an emotional level, and I'm a type of person that likes results, and so I
Yep.
like quick results. And so I was like, all right, well, sexual medicine and fertility is something I want to do. And then from there, I did a fellowship in Houston. We were talking about Texas, so I
Yeah.
lived in Houston for a while. Did a fellowship, and I just honed in on all my skills for sexual medicine for men and women, and did microsurgery and male infertility.
Mm.
But one of the moments that I had when I was a resident always kind of sticks out to me. It was a moment where a guy, he had just been diagnosed with prostate cancer,
Mm.
and he was cured of his prostate cancer. I was a resident. I was in the room, and my attending had left the room, and the guy just started crying. He's just like,
Mm.
like what I'm like,
Joy
listen,
too.
you're like, why are you crying? This is like, and he's like, he told me that essentially he understood he was cured of prostate cancer, but he couldn't have intimate relations with his partner. And to me, to him, that meant more than
Hmm.
being cured of cancer. And I was like, I
Hmm.
was baffled, right? You're like, cancer, you just can kill you. But, the importance of intimacy and being with your partner, that really, like just stuck
Important.
with me.
Mhm.
It really stuck with me. And then from
Mhm.
there, I just wanted to get into the field, and I did a fellowship, and here I am.
Wow.
A long answer. I don't want, it's a long-winded answer, but
No, that's great. I love to always hear that transformation of where it went from one to the end and how you
yeah,
end up in that particular field. So I like
yeah,
that.
little instances like that kind
Yeah.
of brought
Yeah.
me to the field. And I mean, I love what I do, and I always, there's so many people, and that just, unfortunately, they don't love exactly what they do. I'm
Yeah.
just so fortunate where I get to really help people every day, and
I know.
it's great.
What a rewarding job. That's amazing. So I wanted, well, first of all, I'm going to say, because I'm half Jamaican, so I wanted to say
Oh,
that
there you
about
go.
your
There you
mom.
go.
Yeah, yeah, my mom's Jamaican too. So very cool. And then I just want to kind of say to the listeners out there that I am kind of just going in on questions, very, all different topics, because I want to cover a lot of things today. And so often I tend to kind of go off on stories and tangents, but there's so much information that I think you can provide. And I really want to make sure that we touch on all of that just so that they understand that. So I'm going to start out by asking about Ozempic. This is like all the rage right now. I mean, it's like all I see, and probably because I clicked on something on Instagram, it's all I'm getting
Yeah.
consistently. And so it's just been all over the news for weight loss. But what does it do to your testosterone? Because I've
Yeah.
kind of heard that. Does it raise it or lower the levels? And how can this impact a men's health? And I guess the women's too, with how it affects them. Can you touch on that?
Yeah, so as we know, Ozempic is kind of this wonder drug that everybody's on.
Yes.
It was originally made for diabetes, and they said, all right, everybody's losing weight, so it's a bigger market here, so let's kind of go after that.
Yeah.
Um, so Ozempic, looking at the data for Ozempic, and you look at articles, and there's a lot of medical articles, and there's some articles that show that testosterone can go up, right? So hormones can kind of benefit, but there's some other ones that show that it can get worse. So there are some people that get some muscle wasting, and with
Okay.
that muscle wasting, they can lose a little testosterone because when you're making muscle or when you're gaining muscle, you're gonna increase. You can increase your growth hormone that can lead to increase in testosterone and other. It's like a whole pathway.
Mhm.
So the data is really not there yet. The data is
Mhm.
not that strong either way, to be honest. I find that because we check testosterone on all of our patients, I find that the patients that we have, and this is my own kind of study, that
Mhm.
patients that do have muscle wasting, they're going to have some lowering of their testosterone. And
Okay.
so for some of our male patients that suffer from that, we will kind of supplement their testosterone
Mhm.
either with testosterone or some other products to do that.
And
But
so, but it does cause muscle wasting in women as well.
for women as well. And
Yeah.
so for those patients, there's other things that we can do. So for instance, we do provide we do a lot of postmenopausal hormonal therapy.
Mhm.
And so for them, we may want to introduce testosterone to them as well. But on
Mm.
the other end, if you're losing more fat than muscle, then your
Mhm.
testosterone can go up actually in both men and women. So we see that as well. So it really depends on how that particular person responds to the Ozempic or whatever the GLP-1 that they're using.
Yeah. Is there one that you're finding? Is there one that's better than some of the others? I know there's so
No, we
many out
see we
there.
see it's we see that variation of the ratio of fat to muscle
Mhm.
differences, and either of the products. It's really that individual that we see that some testosterone, you know, when we measure testosterone, sometimes a guy will go up or a woman will go up, and the same thing going down.
Yeah. Yeah.
So
And
it's
then,
really hard. So the data's not really there yet where we can definitively say that um, that it causes lowering testosterone or what have you.
okay, so I want to touch base on the testosterone more in just a second, but I'm kind of stuck on this Ozempic thing for a minute because I'm understanding there's a lot of different criteria to be able to get the Ozempic or any of these. Is what are they looking for exactly? And is it have to do with, I see stuff about the BMI, but there's also certain things that it'll ask questions. I was kind of playing around to see, because I don't know anything about it, what they're looking for with that stuff. And it asks a lot about the certain medications you're taking, how much
Yeah.
weight you're
So there's
going to, yeah.
So you know, in terms of somebody qualifying for Ozempic or let's say trizepatide, it's really insurance dependent, and so they'll
Mm-hmm.
have some requirements for BMI, and every insurance is a little different, to be
Yeah.
honest with you. So to go through that is a lot, but you know, and obviously some of these medications are used for diabetes as well. So if
Yeah.
it's used for diabetes, then there's requirements for that as well. But
And
every different.
the
But
ones that
every
are saying they're not covered with insurance, are those ones we need to look out for? Is there anything different? Or they're still fine? They're just people trying to get
Yeah,
a
I mean,
lot of
if
money.
you're trying to go through insurance, if your insurance doesn't cover it, then you have really one option is to try to pay, you know, self pay it and
Yeah.
not go through your insurance for that.
Which is a fortune. All right. So going back to the testosterone. So what's actually considered a normal level? And how do age, lifestyle, other factors play into what would be considered healthy for someone?
Yeah, so testosterone. So that's always a loaded question because um, testosterone levels they change throughout time, right? So
Hmm.
if we're talking about men, as men get older, their testosterone levels start to decrease around the
Hmm.
40s, you know, late 40s, mid 40s. Things do start to go down a little bit.
Hmm.
And also, you have this binding protein. It's called sex hormone binding globulin, which is this protein that's made by your liver that essentially starts to bind and gobble up some of the testosterone so it doesn't get into your system. So, a number of
Oh.
things happen as you get older. Growth hormone goes down, a number of things go down. And then, so what's the normal level? You know, I always tell people it's the level that really makes you feel the best, to be honest.
Mhm.
There's
Yeah.
no magical number for testosterone. Obviously, we don't want it to be too low. We don't need it to be too high, but we want
Hmm.
it to be right for that person. And you know, the example I give is that for some people, they need a little coffee in the morning
Hmm.
and they're able to go, right? And for other people, they need 2 or 3 cups of coffee to go.
Yeah.
Same thing with testosterone. In terms of the receptors and how your body processes the testosterone, some people need less than others, and some people need a lot more. So it's
Hmm.
really like the conversation that you have with your physician. We look at the signs and symptoms of low testosterone for men, like if they have low libido, if they have fatigue, if they're not gaining muscle mass. For if they have really low testosterone, they have some problems with fertility. They may have some issues sleeping. There's a number of these symptoms that we're looking for, and then we combine that with their testosterone levels. So, for instance, if a person comes in with a testosterone of 2,000, right?
Hmm.
No, it's not their testosterone, right?
Okay. Yeah.
Even if they have those symptoms, we have to look for other things that could be going on because there is this. These symptoms of testosterone can also be the same symptoms of, say, depression, or if you're not getting sleep, or you know, a number of other ailments. So we have to, as clinicians, we have to say, all right, do these symptoms make sense, and
Hmm.
with this level? So you know, there's some guidelines for levels. If it's less than 300, then a person is found to have low testosterone. But we find that even for guys that are in the 400s, they may benefit from testosterone, even though that number is 300 kind of officially. So
Yeah.
it's really about, you know, talking to the patient, understanding what's going on with them, you know, how active are they? If they had a testosterone when they were younger, that's always helpful because that delta, which is a change in testosterone, also makes a difference, right? If
Hmm.
somebody had a testosterone of, let's say, 1,200 when they were 18 and now their testosterone is 300, that's a big drop, right?
Yeah.
As opposed to if somebody when they're 18, if their testosterone was, say, 900 and now it's 300, that's less of a drop. So maybe they're not going to have the same amount of symptoms, right? So
Mm.
it's really just it's really an art form when you're dealing with testosterone on this level, as well as when
Mhm.
we're managing testosterone. If we're giving testosterone, we want to make sure that we're keeping our patients safe, right? There's a
Yeah.
number of things that we're looking for, because in men, it can increase your hemoglobin, it can do some things to your estrogen, and all these things that can cause some side effects, which we don't want, right?
Yeah.
Um, so
Wow.
what is the magic number? There's no I always tell my patients I would be a lot more if I had like a number. People who are successful, they have like yes and no. It's like definitive. This is it, right?
Right.
But unfortunately, like the human body doesn't really work that way. And I
Yeah.
tell my patients, if somebody has a number, then you should run, right?
Yeah.
They don't really know what they're talking about. They haven't dealt with enough people, because I'll tell you, in my office, because we check hormones for a number of reasons.
Mhm.
Sometimes I have a guy that has a testosterone of like 280, which is fairly low.
Okay.
And you think he's going to come in and he's going to have all these symptoms, but he could be operating all of his cylinders, and he's doing great.
Yeah.
Does that person need testosterone? Probably not, right?
Mhm.
Because they feel great, their libido is great, maybe their erections are fantastic, they
Mhm.
have all the energy in the world, they're gaining muscle mass. So for that person, I kind of think of the person of that's kind of a person that drinks like a short coffee in the morning, right? They only need
Mhm.
a little bit, right, to get them going, right?
Yeah.
So to me, that's the answer. It's not as
Hmm.
sexy as like, this is the number. I wish I could be that sexy. I'm not. But it's really just about like understanding that person. That's why testosterone really should be individualized. It shouldn't
Yeah.
just be kind of massed, prescribed. I think that's my opinion on that.
Yeah. Wow. Is there certain foods that men can eat or to kind of keep their testosterone up or their libido up, all that kind of stuff?
Yeah, there's certain things you can do, right? So
Yeah.
exercise is like key, right? If you and exercise is big because exercise induces testosterone,
Mhm.
making growth hormone by lifting weights and resistance training, that's going to induce testosterone. Keeping your weight down, because the more fat you get in your belly, right, the more of that testosterone gets converted over to inflammatory things as well as estrogen, right? And estrogen, too
Mhm.
much estrogen isn't good as well. Estrogen is good, but too much is not, right?
Okay.
Keeping your stress levels down is also really important.
Because
Getting a
that's
good
easy these
sleep.
days.
I know, right? Tell me about it. And keeping your stress down, like you said, it's hard. It's
Yeah.
like people have lives and they work, and it's just so much happening nowadays with so many other things. Without getting to those things, right?
Right. Right.
Sleeping is also really, really important. Gotta sleep.
Mhm.
Like sleep is key, right?
Is it still what, 7 hours a night? 8 hours? Is that
Yeah, like
still
8 hours a night is
okay?
kind of what we recommend. And what that's doing is like that's keeping that circadian rhythm. So your hormones are secreted a little higher in the morning and then they go down. And you go through this circadian rhythm throughout the night, as well as actually if you look throughout the year, there's certain times where there's like peaks and valleys and things like that. So staying in that circadian rhythm of sleep is probably one of the most healthy things that you can do.
Hmm, interesting. And speaking of that, I heard that like red light therapy works for circadian rhythm. Is
Yeah, for
that
some people it does. For some people it
yeah.
does.
Okay, so let's talk a little bit in comparison though about women and how they're dealing with the low libido and the menopause and all of that stuff. So how does that work? Also kind of just comparing it to men with their testosterone and things that women can do. Because I know, I mean, I'm 50 this year. I think I'm in menopause. I didn't really have a period forever, so I don't really know, but I sleep terribly, but my libido's up and all of that stuff is good. So I'm kind of confused. And I'm sure there's others that are out there pretty confused too.
Yeah, I'll tell you, women have, when it comes to menopause and hormones,
Hmm.
they just, they have it a lot worse than men, right?
Yeah.
I mean, and that's like an understatement,
Across the
right?
board. It's across the board, I feel like.
It's horrible. Men, they'll lose their testosterone over time, right? And it's a
Okay.
slow, gradual kind of loss of testosterone. Where
Hmm.
women, around the age of 50, as you know, it's kind of the age of menopause. And what happens is there's a drop. I mean, obviously over time the women do lose their hormones gradually, but it's more of a drop, especially around the 50s.
Hmm.
And that's when the ovaries just stop producing hormones essentially, right? And then you get
Mm.
lack of estrogen, you get a drop in testosterone. And then all the other hormones that the estrogen, the testosterone make, like they make other things, right? And
Hmm.
so with that, you get a number of symptoms, and those symptoms could be hot flashes, right? Because the
I get
lack
those.
of progesterone and estrogen and all these imbalances that happen. There's some anxiety, so a lot of women will experience more anxiety at that time, some lack of sleep.
Hmm.
Sexually, they can have lower libido. They can have dryness in the vagina. They can
Hmm.
have pain with sex, right?
Hmm.
Itchiness. Some women develop some pelvic floor dysfunction because of this. So there's a number of things that happen during that menopausal period.
Hmm.
And as you get, obviously, and when we talk about testosterone, you get a drop in testosterone as well. So
Yeah.
those are all symptoms that kind of come with it.
Ah, it's really difficult getting
The
older.
good thing is that, and it's 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 also difficult because it's at that time of life where, for women that have had children and the children are now out of the house, it's like
Hmm.
a time where, like, it's like a freedom. It's freedom. It's like, you're in your 50s and you're kind of getting your
Yeah.
stride. You're feeling more self-confident about things. It's just a perfect
Takes
time.
me
And
down.
then you got this thing that just hits you. Um,
Yes.
and it's very difficult, but it's not something that has to, the symptoms can be abated, and it could be, it's helped. We help women that are in menopause or that have gone
Yeah.
through menopause or in perimenopause all the time. So women don't have to kind of suffer with these symptoms. There's a number of things that could be done to
Hmm.
help with this. And so I think, for all your listeners out there, if you're having these symptoms, and if you're of the mind that there's some people that are like, all right, this is naturally happening, and I don't need treatment, and it's just part of life, and that's
Yeah.
fine. But there's other people that are like saying, like, all right, this is something that I don't like. These are symptoms that I don't want. All right.
Yeah.
And
Yeah.
I want to do something about it. And there's something to be done about it.
Yeah.
And if it's done correctly, like, you can feel wonderful again.
Yeah. Yeah. I've kind of heard that from some of my girlfriends who have gotten on like hormone replacement therapy, and they're like, oh my God, it's like life changing
Life
for them.
changing. Yeah.
Yeah. Which is
It's
exciting.
especially for my patients that, are high functioning individuals. And, some women get like this brain fog, and,
Yeah.
and they just can't, like, words don't come to them like they used to, or they can't think or concentrate. And it really just helps them.
Yeah. Are
So,
there things that they can take if they have any kind of, if they've had blood clots or things like that in their past and they can't really do as much hormone stuff? What do you suggest for that?
yeah. So blood clots are a big issue, especially
Yeah.
when it comes to hormonal therapy. Any kind of I tell my patients, any kind of hormonal therapy, if it's testosterone for men, if it's estrogen for women, if it's testosterone for women, any hormonal therapy can increase your rate of blood clots at
Mm.
least a little bit, right? So even
Mhm.
women on birth control, if you kept up with the literature, you'll see a person on birth control they can also have clots. So then we're a little more symptom specific, right? So
Mhm. Mhm.
if we're treating, say, a patient that has pain with intercourse and
Mhm.
low like their lubrication isn't where they want to be, or they have itching or changes in pH, then we're going to directly treat the vagina, right? If it's
Mhm.
libido, then there's things that we can do that are non-hormonal that will treat their libido, right? So
Oh,
it's a little bit more directed, as opposed to kind of treating the whole body. But
yeah.
those are things that we even so for patients that have certain kind of migraines, they also can't have hormonal therapy. And
Mhm.
so we see that for them. We have a whole system for women that have had breast cancer, and they also can't undergo any kind of hormonal therapy, and we help them as well. So
Other
there's always
alternatives.
ways around it.
Yeah. So just gotta get with their doctor and go over some different alternatives.
Yeah,
Sounds
get with
like
the
a
right
plan.
doctor. Get with the right.
Yeah. Yeah, the right one. All right, let's talk about some prostate cancer, which is never fun, but there's a lot of debate around the screenings on these. So, do all men really need to do them? And when should they start getting checked? And what factors make the screening more important?
So I'm an old school urologist. I think that everyone should get treated, should get checked
Mhm.
for prostate cancer.
Yeah.
There's new guidelines that came around, and they kind of they put men into different risk factors, and
Okay.
so the people that have a higher risk factor, they should probably get checked earlier. And in my
Mhm.
mind, early means around 40.
40. Okay.
And then for low risk, it's about 55. So high risk are African Americans.
Hmm.
They're patients that have a family history of prostate cancer.
Mm-hmm.
There are families that have higher rates of like other, it's called adenocarcinomas, other types of cancers, like if it's breast cancer, ovarian cancer, pancreatic cancer, if it's been metastatic in that family, then those patients should also be in that higher risk category. And in those
Mm-hmm.
patients, that what we do is we check a PSA, which is a blood test, and then we do a
Mm-hmm.
rectal exam. And then I have guys like, Doc, I don't want you to do a rectal exam on me. Like, don't put your finger there and all this other stuff. And I'm saying, I say, listen, that's fine. I'm like, I'm not forcing anybody to listen. I don't
I
like
like
it.
you're wanting to put your finger there.
It's like, it's fine with me, but at least get a PSA. And so it's a
Yeah.
blood test. So it's like if you're getting, a PSA is harmless, right?
Mhm.
It's a test that you get. I mean, it's just drawn blood. And so
Yeah.
one of those things that can really detect prostate cancer early.
And so for those who have had prostate cancer treatment, well, you talked about this with the guy that was upset about couldn't be with his partner. What does sex look like after having that kind of cancer, and how can they regain their function, and what are some of the best options that they have for treatment with that?
Oh man, that's a handful.
I know we can break it down.
Oh man. All right. So prostate cancer. So when someone is diagnosed with prostate cancer, there's a number of therapies that they can have, right? So first of all,
Okay.
they can do nothing and they can watch it. So
Okay.
we've kind of progressed since I was a resident, a decade, 2 decades ago, where
Hmm.
every time we saw an elevated PSA and somebody had prostate cancer, we removed the prostate or they got radiation. Now, depending on their grade, so how severe it is, some guys we just decide to watch, and we'll check a PSA, we'll do a biopsy, and if the PSA doesn't go up by a certain degree, or if we do a biopsy and it doesn't progress, then we can watch those guys for a really long time, right? So those guys will have no sexual problems, right? Because they're not getting any treatment, right? Well, unless they were going to have it anyway, right? There are other men
Hmm.
that undergo prostate cancer surgery or radiation, and those men oftentimes have some type of sexual dysfunction, right? Not
Okay.
all, but a number of them do. And when
Mhm.
you look at like who gets it, like it's who's going to have some sexual problems. It's going to be men that have already had some sexual issues. They're probably going to get worse. And the older you are, then the more likely you are to also have some problems. So if somebody
Mm.
has prostate cancer surgery, it's the same exact surgery. The one person is 35, which is really young,
Mhm.
but in the other person's 80. I'm just giving extremes. The person that's 80 years old is going to have more of the issues.
Mm.
Right. And those issues can range. They can range from, and the way I kind of look at ED is it could be a person that has some issue with starting the erection. It could have a person that's maintaining the erection. They could have both. Um, and so it just depends, right?
Mhm.
But we treat it. So for us, there's a number of treatments that we have in our practice and we have special kind of protocols for men that have had prostate cancer therapy, and we'll
Okay.
put them on one of our programs depending on what the issues have, and those programs depend on with oral medication. We do some restorative things for the erections. Injection.
Mm.
It just depends on the severity. Sometimes we use pumps to kind of sometimes like pumps can to increase the size of their penis or to exercise their penis. It just depends on like what particular symptoms that person has. But
Mm.
it can be treated for the most part. All right.
Okay.
Sometimes you'll have to do like if it's very severe, then a penile implant is something that also can treat that.
Oh, so there's options that they can do for different things.
There's so many
Yeah.
options. There's so many
Yeah.
options. One of the issues, though, I see that is with prostate cancer therapy is that sometimes guys kind of wait too long to
Mm.
start getting therapy. I like to see guys like right after therapy or even during radiation therapy, so we can really start helping with their sexual function.
Yeah. Oh, that's tough. So talking about erections, does losing an erection almost always mean that someone has erectile dysfunction? Like what's normal, and when should a man be concerned about
No,
that?
I mean, if it's happening often, then yes. But I mean,
Yeah.
you guys lose their erection if they're drinking too much, if they're anxious
Yeah.
about the situation, new partners. Um,
Yeah.
if they're not turned on or if they're turned off, it's a lot of things
Yeah.
reasons why a person can lose their erection. But
Mhm.
if it happens consistently and it's a bother to them or their partner, then they should
Mhm.
definitely look for some help.
Yeah. And sometimes it could be a mind thing, right? Because your mind, you're going crazy. You're so busy all the time. You're thinking of that. And then when you start focusing on it, we all know the more it doesn't happen, the more you're focused on it, then, right? So it
Yeah,
becomes like
yeah.
this,
Yeah, your
this
adrenaline
thing.
goes up, and then you start getting in this fight or flight response. Blood flow stops leaving, goes to other places.
Yeah.
There's so, we're so complex as humans.
Hmm.
I wish, I was telling a guy the other day, I get close to my patients, and he
Yeah.
was really anxious about having intercourse. And we were
Uh-huh.
just like, listen, like, that bird outside, or that like squirrel outside, or that lion or whatever, it's not really, it's so innate for them. And
Yeah.
as humans, we have all the stuff that we put in front of it,
Hmm.
and so sometimes we just have to break things down to like the elements of things, and so we were talking about that. And yeah, it's just, I think that adrenaline can get in the way, like life gets in the way, stressors get
Yeah.
in the way, but oftentimes that's just a part of the problem.
Yeah.
Sometimes that amplifies the problem, but oftentimes there are other things that are going on that could be causing the ED. So I don't
Ooh,
think
like what?
that we should chalk it up to that, right? We can chalk it up. We know that there's other things like, guys that have high rates of hypertension, or
Hmm.
high cholesterol, or issues with hormones, or problems with scarring of the penis, or, we talked about stress and relationship issues. There's so many things that are involved in the erection and the
Hmm.
causes of having erectile dysfunction. I don't think we should ever chalk it up to like, I'm stressed.
Yeah.
I just don't believe in that. And same thing for my patients that are women. I feel like women get pushed under, like they don't get listened to, because they're like, all right, well, you're a woman, and if you're taking care of your kids and you're doing all these things, you're stressed, and this is the reason why. No,
Right.
that's not, come on. I mean, that's probably part of it, but
Yeah.
it's like something that's biologically going on that you need help with.
Yeah.
And so, and it just drives me crazy, because if, when men have a sexual problem, it's like, all right, we're going to attack your penis, we're going to do this, we're going to really help you. And then when women have a problem, it's like, because you're stressed, and because you're doing
Right.
too much and all this stuff. And I hate that, because it's such a bias.
Yeah.
And I just find, like, the things that I hear from my patients, like when they either see their physician or whomever, go read a book or watch some porn and it'll get better. And it
Hmm.
didn't happen. I mean, a lot of this is biologically happening, and you need help.
Yeah.
That's
Yeah.
my thought. I mean,
No, I agree. I totally agree. How do you kind of determine what it is then? Because you said it could be for a man, ED. It could be so many different things. Like, where do you even start to start? I can't think of the word. Like tossing things out that maybe it's not that.
Yeah. So it all starts with a conversation.
Oh, just finding out where they are in their life right now.
Yeah,
What
it's
things are
like,
going on.
I'm pretty blessed. Like, I have a practice where I can sit down and talk to my patients.
Oh, I
I mean,
love that.
I
No.
mean, we're self-pay, so that's the only reason why I can do that. But
Yeah.
like, I spend about an hour with my patients, and so I really get to learn a lot about them
Mm-hmm.
within that time.
Mm-hmm.
And we go through a number of these things, and
Mm-hmm.
then we order the right testing, and we do the right physical exam, and we do all these things to really
Mm-hmm.
tease things down, so we know exactly what's going on with them.
That's good. I like that. I like that. So, we've all heard about penis pumps. We're going to talk about this. Do they actually work? Or is it just kind of one of those things we kind of joke about and say, oh, well, I'll get a penis pump if you get a breast augmentation, Do they
So
really work?
yeah, so penis pumps can come in two different forms. So you can have an internal penis pump, right? That's called a penile implant.
Okay.
And then you can buy like an external penile pump, which is kind of
Okay.
like it's like kind of what you're talking about, like a toy or something, but it's
Yes.
also a medical device, right? And
Okay.
so I use a lot of penile pumps in my office. I use tons.
Really?
Everybody gets a penile pump. You come in, you get a penile pump. It's
What?
like
It's like a parting
we're
gift?
giving them out at the door. We're giving them out at the door.
You
No,
get a pump and you get a
I everybody gets a pump.
pump.
Like for guys that have prostate cancer in particular, we know that for a number of guys, their penis, you get some decrease in size. So
Hmm.
penis pumps, it's been shown in the literature that when you're using a pump, we can get some of that length back. Like, nobody
Yeah.
wants a smaller or shorter penis, so we want to make sure we get that length back. But
Hmm.
also in studies, it shows that in terms of rehab for men that have had prostate cancer surgery or radiation, there's some, at least in my mind, there's some strong evidence that shows that it helps with everything that you're doing. It helps just increase blood flow going to the penis. It helps just kind of stretch the muscle. It helps on a micro level as well, where we're really bringing some growth factors to the penis. So it's just, I just think it's the best thing. Yeah, I'm a penile fan.
So that's why you kind of give it to everybody, because they could just have certain things going on, or what do you mean you kind of give it to maybe not everybody?
That depending on why they're here, we have different protocols for them in terms of use for exercise even during the day. So especially for guys that aren't getting those nighttime erections, where it's like the time where you're supposed to be getting the most oxygen to your penis, and when you're not getting those, what's happening is you're really causing some micro damage to the penis that can then roll over into ED. So we want to make sure that we're getting some oxygen, even though, so if you want to, on the scientific level, it's not as much oxygen as you're getting if you have an erection, but it's a close second. It's the best we can do. So we really want to try to force that blood flow into the penis and really help guys kind of oxygenate the tissues.
So it's something that they're just using at the time when they're like about to have intercourse.
So that's another way you can use it. So that's using it for sex. You can use it when you use it for sex. You're going to kind of pump up the penis, and you can place a little band at the base of the penis, and then that can then kind of keep the blood flow in. So we can use it for that, but I also use it for exercise and.
Just to get the the blood flowing in it and keep it.
Exercise. You can use it while you're drinking martinis at the whatever. No, I'm joking. But we use it for a lot of different things. Yeah. So we use it for exercise. We use it for rehab, and then we also use it for sex.
And if they use it for sex, everything feels the same, like during intercourse, and they can orgasm the same, and everything can turn out the same from it as well.
I mean, obviously nothing feels as good as a natural erection. So, but when you place the band at the base of the penis, some guys will say that they feel like when they're having an orgasm, it doesn't all come out and other things. But, it's so funny because we're talking about pumps. I had a guy that he came in and he was on a pump and he loved it. Like it was
really? I'm using this all the time, morning, noon, and night.
So it was great for him. So everybody, it's all about finding what's going to be best for you. Like when I have a program for a guy and I'm trying to think about like what's going to be the best thing for them. It's all right. What's that person's personality? Like what's their relationship? Are they dating? Right.
Yeah.
And the person that's dating and single is different from a person that may be in a relationship that they've been in for a long time where their partner's understanding. Right. So it's hard to bring out a pump with someone that you've never met before.
Right.
Some people may like, that's fine. But for a lot of people, it's difficult. Right? Whereas if you're at home with a partner, then a pump is okay. And you can make it part of that playing process. So so it's really just about trying to figure out where do we stand, like in terms of your relationship, what's going on in your life. And then we tailor everything towards that person. Right?
Would I know if somebody was using one, or if I, was with somebody?
If somebody's using an external pump, then because oftentimes you have to use a band at the base to keep the.
Oh yeah. What do you mean a band?
It's like a cock ring.
Okay.
Yeah, so you have to pump it up, and then a lot of guys will
hold it.
To hold it there. Yeah.
Oh. And what about Viagra? Is that like a?
Yeah. I mean, we're talking about pumps. Yeah, everything's on the table. Everything's on the table.
Oh, we can try it all. And then you said I'm stuck on the penis.
I know. I'm seeing you're getting a little. You need some water. Cold water on you there.
I'm like, nobody ever talks to me about this stuff. I'm very excited. But so the internal, or a penile implant.
Yeah, it's a surgery. So that's a surgery where guys will who have severe ED, where we've tried everything, or
the last resort kind of thing.
Yeah, it's kind of one of the last things that we think about for guys. And those guys will have a surgery where we place a component, a penile implant into the penis, and they have a pump that's in their scrotum. And then when they want to have intercourse, they kind of pump it up and then flow to the cylinders, and they're able to have intercourse. Yeah.
God, it's fascinating. All right. I'll move on from it. I'll move on. Okay. Next question. How much does diet really play into sexual performance? Can we eat?
Yeah. I think, like, who doesn't want to feel sexy, right? And so eating, if we're not eating the right foods, I mean, just on that level, right? I think, men, the biggest complaint I get from men is like, it's like they don't feel appreciated. They don't feel, I'm telling you, like these private conversations,
Yeah.
women say the same thing. And,
Yeah.
if we're not eating right, if we're not kind of trying to keep our body, I mean, obviously there's unrealistic things, but like within, realistic expectations, then our sexual function is gonna probably go down a little bit.
Hmm.
I find, obviously when we talked about if you're gaining too much weight
Hmm.
for men or women, right? Especially for men, then some of that estrogen that weight, is gonna that conversion for testosterone to estrogen and your ratios kind of get changed. Obviously, if you're gaining a lot of weight and you're not eating the right food, the fats
Hmm.
that we have, they make all this inflammation. We're at a higher rate for heart disease and stroke and all these other things. So we really want
Hmm.
to pay attention to our what we're eating and our weight for not just our sexual function, but for our overall wellness. So it's
Yeah.
really important that we're eating the right foods,
Hmm.
that we're paying attention to our weight, that we're doing resistance training if we can, if you're able to try to
Hmm.
build muscle, especially as you get older. I always tell my patients that are older, like one of the best things they can do is in terms of like health and everything is obviously eating well, dieting, um,
Hmm.
weight resistance, but also keeping flexible. Nobody talks about flexibility.
Yeah.
Flexibility is so important as you get older, right? You
Yeah.
fall, you want to be able to kind of grab onto things, you want to stay flexible. So being
Yeah.
flexible is really important. So stretching and all those things
Yeah.
are great.
Yeah. And can the certain foods impact erections too?
Yeah, well, I mean, overall, right?
Is
So if
that a
you're eating
myth?
high fatty foods and everything, your cholesterol is going to go up, and that's going to affect your erections. You're going to have
That's going to
higher rates of
contribute.
diabetes. You're going to have higher rates of high blood pressure. I
Hmm.
wish there was a superfood that you can just eat and then you're just, and
No.
guys will be ready all night. I haven't found that yet, but if I find it,
Let us
I'll be on
know.
top of the mountain somewhere.
So
So,
true. So, on the topic of vasectomies, many men don't realize it's not an immediate fix. What should they know about the timing of that if they want to change their mind later, and how effective are the reversals of that?
so I do both. So I can
Oh,
tell you a little bit about both. So
perfect.
there's tons of vasectomies that are done every year. I think it's close to like 500,000 vasectomies are done every year.
Wow.
They're very effective. This failure rate is about 1 in 2,000. It's probably the
Mm-hmm.
failure rate.
Mm-hmm.
But after your vasectomy, you can still have. So if you have a vasectomy, you go home, you have intercourse, you can still have a baby, right? So
Oh,
we want to wait at least 10 weeks or so, and we want to do a semen analysis. And
before you start trying without a
before
condom.
we start to
Mhm.
try to have intercourse that's unprotected.
Okay.
So, and then we can have intercourse. I mean, there's the rate of failure after that is still fairly, very, very low, but it's still a possibility, but it's extremely low. All
Okay.
right. And then vasectomy reversals. So I think if you go to the right specialist, then you're going to be fine. So,
Mm-hmm.
for instance, I did training in microsurgery, which was a special fellowship for vasectomy reversals. So,
Mm-hmm.
and if you look at guys across the country that had similar training, then the rates of success for vasectomy reversal is having sperm in your ejaculate. It's not about having a baby; it's about having the right amount of sperm.
Mm-hmm.
Then those rates of success are very high, like 80 to 90%, depending on the person and depending on how long was their, like how far from their vasectomy did you do the vasectomy reversal. So for
Mm-hmm.
instance, a guy that had a reversal after having a vasectomy after 1 year is going to have a better success after having a vasectomy if somebody else having a vasectomy after 20 years. So
Yeah.
that is like the biggest prognostic sign of success. But then you have the partner, right? So I'm giving you rates of getting sperm in the ejaculate, but the pregnancy rates are going to be a little bit lower because depending on that partner, if that person's fertile, how old that partner is, and other things like that's going to that's going to also
Mm.
kind of give you numbers for pregnancy levels.
Are there any negative effects from having a vasectomy, or is it just not really?
No,
No.
you know, I mean, anything you ask, it's always like
There's always
yes,
something.
but no. But in general, no. I mean, obviously, for any procedure, you can have bleeding, you can have infection, and
Yeah.
just complications. Those complications are very low. There are a subgroup of guys that are forced to have their vasectomy, so their partner may say you need to have a vasectomy, and those
Mm.
guys maybe have a higher like tendency of having like erectile dysfunction and lower
Mm.
libido, just because of the fact that, and it's a psychological thing.
Yeah.
It's usually because they feel demasculized when they're going into the procedure, and
Yeah.
so they have like regret, and then they can have some
Ugh.
cycle. But that's not common. So for
Yeah.
the record, that's not common.
Don't freak
You
out, people.
Yeah, don't ask me these questions because I can always give you
I don't
something.
want the answer. Don't ask the
Right,
question.
right. But in general, I'll tell you, guys are really happy. It gives them like a sense of freedom, sexual like
Yeah.
awareness. It's you can control your family planning. It's a great procedure to have
Yeah.
if it's something that somebody's interested in.
Is that like a in and out, like a day in and out,
No,
or is it an overnight?
for the vasectomy, it's 20 minutes.
What?
Yeah,
Oh, you put
it's
them
a
under? You put them under.
No, we don't put them under. We
Oh.
just do really good numbing. And in my practice, we do like same day vasectomy. So we have guys that
Oh.
come in, we do a consultation that day. I do a consultation for like 45 minutes. We talk about the risks, the benefits. We go through the anatomy. And if they want to have their vasectomy, we just go in the other room and do their vasectomy and they go home. So it's
Oh
really
my
simple.
God. I had no idea it was
Yeah,
that
I mean,
fast.
yeah, we do that. So we try to
And,
make it easy for our patients.
but the reversal's more work
Reversal
than.
is a little more involved. Yeah. So,
Okay.
for microsurgery, it can take a few hours.
Wow. I'm learning a lot right here. All right. For the ladies, this is for you ladies out there that want to know about, quote, the vampire vagina treatment, what that's all about. Is it really effective for vaginal rejuvenation, and who would benefit from it? What is
So I'm trying to
it?
think of so the vampire vagina. So essentially what we're doing is there's a number of procedures that we do. It's something called PRP, which is platelet-rich plasma. So for
Hmm.
men, and so the way it works is it actually stimulates like growth factors and these stimulatory cells that come to the vagina, the penis, that can help to amplify sexual function, but it also helps with healing. So in the orthopedic literature, they'll place PRP in shoulders and knees to kind of help with restoration of the joints. Not FDA approved, but I find that it works great. And so we use PRP for a number of things when
Hmm.
we're for sexual function for
Hmm.
women. There's something called the O shot,
Hmm.
which we use that can help with orgasms. It can help with lubrication.
Great name for
Other
it.
Yep, there's other things that we use. We can use it. There's a scarring thing called lichen sclerosis, which is kind of like a scarring disease of the vagina. So we can use PRP, and we use that with other techniques to kind of help with that
Hmm.
disease process. So it's a number of
Hmm.
reasons why we can use PRP. So I think you're
Hmm.
talking, and there's other procedures where they place it in the. I don't do this procedure where they place it kind of in the vulva to kind of um, could kind of plump up the vulva a little bit, so
Hmm.
it's a little more full. So there's other ways. It's like a lift. So you can also do
Hmm.
a lift with PRP. So there's a number of things that you can do to kind of rejuvenate the vagina. I always find for me, I start if it's somebody that's postmenopausal, I always start with hormones because I think that's the base, and
Yeah.
then we add these other things depending on what the problem is. If it's lubrication issues or atrophy of the vagina, then we may use like a certain laser that we use to kind of help to stimulate that and hormones. Or we'll use like PRP, or there's so many other for orgasms. We use something else to help
Hmm.
amplify orgasms. So it just depends on what the problem is, and then we try to fix it.
So, and maybe I missed when you said this. Where did the vampire part come from?
It's because of the blood, right? So we're
Oh.
drawing blood. So that's where it came from.
Oh, okay. So a lot of people get that where they do vagina rejuvenation and have it fixed up. Is that a normal procedure? Is it mostly for people that have had some sort of an issue down there, not just for women,
It's for
a
both.
cosmetic
It's
thing?
for women. Some women want to enhance their sexual function. For other women, they have some other issues that we use it
Uh,
for. So it really depends. I mean, we see both, to be
wow.
honest with you.
Yeah.
So it really depends on what the issue is. You know, I think that for your listeners, I think that the person that they go to they need to have like a stepwise approach. Like,
Mm.
I just there's some patients that come to my office like I just want this done, and we talk to them and like, all right, we'll do it. But if it doesn't work, then we really need to take a step back, right?
Yeah.
And I always tell my patients we should start at least knowing what your hormones are, what's going on. We do an exam, and then we try to figure it out. I mean, that's the
Hmm.
way I always prefer it to be
Hmm.
done.
Hmm.
Um, as opposed to just like going straight for this. Because, if your hormones are off, then no matter what we do, the vagina is not going to work, right?
Yeah.
You're like,
Yeah.
you have no testosterone, you have no estrogen, you have no hormones, then that's probably the reason why you're not getting orgasms, or that's probably the
Yeah.
reason why you're having some difficulty with lubrication. And the PRP, if it helps, it might help it just temporarily, but it's not going to help it over the long term, because you're going to revert back to needing those kind of bare essentials. And
Oh,
so it's such a complicated thing. There's in my field now. When I started sexual medicine, like nobody wanted to do, nobody knew about sexual medicine, but
yeah.
I think now everybody's like into it, because it's a way and it's nothing wrong with running a business,
Yeah.
but it's a way for people to make money, right? And so it's like,
Sure.
all right, you kind of come here, but like you got to really be treated. You have to do the right thing, and you have to make sure
Hmm.
you know the basic information, and you really get to know your patients, and you understand what's going on with them biologically, and that's the way you
Hmm.
pick them. And I think that's why we've been around for, I think my practice, we're almost like 10 or so years in
Amazing.
practice, is because like we do that, you do the right thing, and people get better,
Yeah.
just kind of doing one. Like if somebody's like a one trick pony, that's fine. I'm not,
Yeah.
everybody's, but for us, it's really trying to get a comprehensive approach, and
The whole
then
package.
kind of treating that person. So
Yeah. And you had mentioned before that it's self pay. And for people out there maybe that don't have a lot of money but want to kind of find out some information, is there different levels of stuff that they can do with you to kind of fix a few things, but maybe not everything?
yeah, I always say that. It's funny because when people see me, it's always like I'm always the last person on their list. Like it's Valentine's Day, and it's like, Doc, I need you to fix me by tomorrow. And it's like, oh, you know. I always, we always try to make it affordable as possible.
Hmm.
I mean, I have this like, I used to work for one of the universities. I'll tell you, like, this, maybe it's a little too personal, but I used to work for university. I was in New York, and I used to see everybody. I loved it,
Yeah.
right? But the problem was that, and this is the reason why I had to shift, and it's horrible, and it says something about medicine, maybe something about me, I don't know, but I had to see, they put 50 people on your schedule, and you just didn't have the time to like sit down and talk to people.
Yeah.
And for me, that wasn't rewarding, right? It
Yeah.
just wasn't. And unfortunately, this is not, unfortunately, the only way I get to do what I do is because it just has to be self-pay, because for insurance, I just don't want to ever I don't want to ever have to do that again.
Yeah.
With you. I just don't want to have to say, all right, I got 5 minutes with you, regardless of where you are in your conversation. I have to cut you
Hmm.
off because I have to see
Hmm.
someone else. Right.
Yeah. Yeah, for sure.
And maybe it was just the system I was in. I don't know.
Hmm.
But for me, this is so much more rewarding.
Hmm.
And I know that I can't see everyone.
Yeah.
That really eats at me, just because of my background and where I come from. And I
Yeah.
know I can't see everyone, but I feel like the quality of like my time, and like the quality of the outcomes that we get kind of make
Hmm.
things a little worth it.
Yeah, but I'm sure they feel the same way as well, because we tend to feel that going into the doctor, and when you're just like you're like, oh no, you kind of feel like you're always trying to
Yeah, of
just get it
course.
out. Yeah, and
And
that's
so I can't see. I mean, the reality is we can't see everyone, but
yeah.
I know there's a number of people that, I would always start, for some people, they can start with their GYN and
Hmm.
see, if they can get something done there or what have you. Um,
Hmm.
it's just, I don't know.
Not
It's
easy,
hard.
but
Yeah.
yeah, yeah, I got you. I got you. Well, I love hearing about all of this. This was really good information. Oh, the one I wanted to ask about that I forgot that I wasn't going to ask, and then someone said to, was about the Scrotox, Botox for the scrotum.
And you
Okay.
do everything in our office. Yeah. So there's Scrotox. So
What does that do for it?
more of aesthetics thing that we do in the office. So we do girth enhancement in our office. So we do a lot of guys that they want to be girthier, and
Yeah.
so we do that aesthetic procedure in our office. Botox really helps for us in terms of if it's given the right way and during the right part of the treatment. We use Botox for the penis. It helps with that, for erections. And then Scrotox is what we give to what we replace Botox, or like one of the other Botox neuromodulators in the scrotum of the
Mhm.
patient. It helps it really relax. And so for
Mm.
some guys, aesthetically, they like that look. But for other guys
Mhm.
that have chronic testicular pain, where their testicles may go up and ride up, especially during intercourse. I have some
Yeah.
guys where their testicles kind of ride up into their groin, and when they're having
Ooh.
intercourse, it causes discomfort.
Yeah.
And so we can place Botox in their kind of spermatic cord that kind of bring down their testicles.
Oh, okay.
So there's a number of reasons why we do Scrotox, but everybody thinks of it as more of the aesthetics
No,
of making your
it's going to
your
be stiff,
scrotum
not
like
move, no
Cosmo
crinkle.
ready. He could be in the magazine, and that's fine. We help with guys like that too.
I love it. I love it. So tell everybody where they can find you. Let them know your website and all that good stuff.
Yeah, so website is Rockwell Centers. It's Rockwell Centers.
I'll put it in the show notes too.
And we're located in Philly. We have an office right outside Philadelphia. I have an office in Manhattan,
Mm-hmm.
right across from Grand Central Station, and then we're also in Allentown and Lehigh Valley.
Mm-hmm.
I guess it's always so bad. So Instagram and Facebook, I think it's at Dr. Gittens. So you can kind of
Okay. I'll
follow
make
me.
sure I have it correct
Yeah.
in the show notes. And can they do consultations with you, or do you do that?
Over
Or
the internet? No.
yeah, no.
Yeah. So
So they have to be in your area, like to do the first step kind of thing.
yeah, so it depends. So for some guys, we'll do a telemedicine, but they
Mhm.
have to come into the office. They have to see me at some point.
Okay.
So we can't prescribe anything unless they're actually in the state, but we can talk to them,
Mhm.
and then we can kind of get them started, like order labs or what have you. So we have patients from all over the country that I'll talk in telemedicine first, and then once we establish that relationship, they come to the office and they have to be seen and have a physical exam and everything. It's just hard for me to I like to touch and feel, so I like to make sure I like to see what's going on. Like
Mm-hmm.
for women that are having pain, is it because of the fact that they have menopausal symptoms, or do they have something like lichen sclerosis? Do we have to do a biopsy? Like what's going on?
Yeah.
So
Yes.
it's one of those fields where I think that a physical exam is extremely important
Mhm.
for most of the things that we do. Not all, but most of the things that we do, it's very important.
Mm-hmm. Okay, that makes sense. I like that. Okay, so before you go, I want to play a little game called Would You Rather?
Okay.
And you were a little nervous about this at first.
I'm ready.
Okay. Okay, so pretty easy. All right, 10 easy questions. Number 1, would you rather have the ability to instantly diagnose any patient just by looking at them, or develop a breakthrough treatment that completely cures ED?
Well, I don't only treat. See, this is like
I know.
it's like one or the other, right?
That's it.
I don't know. I don't like just. I wouldn't want to just like look at somebody and have a.
Be able to diagnose them.
Yeah, I kind of like. The reason why I love doing what I do is I get to know my patients, and
Yeah.
I like the story behind why they're there.
Yeah.
So that
That's
kind of
good.
intrigues me, and so I would say definitely not that one.
Okay. The good thing is these questions they're not going to matter after this next 2 minutes. So don't worry about it. Number 2, would you rather only be able to say the word moist during patient consultations, or have to use hand puppets to explain every diagnosis?
Oh, I'd rather use hand puppets.
What is it about moist?
No, we don't say moist. Like it's one of those no words.
One of those words. What is it about that? I don't know. It is a weird word.
That moist needs to be saved for like the bedroom and things like that. We don't do any of that stuff.
I don't even think I could say it there without laughing. I don't know why.
Yeah.
Number 3, would you rather have to perform a live vasectomy on stage in front of an audience, or have to explain the details of a prostate exam to a room full of middle schoolers?
Oh, I can do both.
Oh,
I've done both.
you could do it live on stage in front.
Yeah, I can do it. Anybody can watch. Doesn't matter. I don't get nervous.
Ooh, okay.
I've done thousands of vasectomies.
Oh yeah, so it's just second nature to you.
Yeah,
now.
it's no big deal.
All right. Here's a
But I
little
also
bit
like teaching, so I don't mind talking to
middle schoolers. They would
I
be
love
giggly, but
I do that a lot. So.
Okay. Would you rather fall for someone who makes you laugh uncontrollably, or someone who gives you butterflies every time they walk in the room?
I think laughing is probably.
Laughing.
Yeah, I think I'll take
Here's
somebody
that.
that laughs.
That's
I feel like the butterfly. It may make my stomach hurt or something like that.
Are you married? Are you doing?
I am, yeah.
Yeah. Okay. Would you rather accidentally send a mass text about erectile dysfunction to all your patients, or have your entire internet search history of awkward medical questions leaked online?
I wouldn't mind either one.
You're my easiest one on this. You're
Yeah,
like,
like I got nothing to hide, and one of those things that,
Doesn't
when
bother
people
you.
in my office, it's just, we talk about everything. So
Yeah.
nothing is like, it's just, it's very relaxed,
Yeah.
and I try to just, I find the best way to kind of break the ice is just to say it. Like, you just
Yeah.
do things like, and
Just
it's
go with
either way,
it.
it's fine with me.
Well, it's
I'm
funny, I think once you're in this field, because you're so used to talking about it all the time. And, throughout my podcast time, I talk a lot about sex. It doesn't faze me at all to talk about it. And so many people are so, so
no,
weird
yeah,
about it. But
I
once
do.
you can, anything
It
goes,
is
right?
all day, every day. So
All day, every day. All right. Would you rather have the ability to read your partner's mind during sex or be able to control their sensations with just a touch?
oh, I don't know if I want to read anybody's mind.
I know, right?
I don't know. That's like a superpower I've never
Nobody
wanted.
wants that.
I don't want to know what you're thinking. I don't ever like to know. I don't want to know what anybody's thinking, to be honest.
Right,
Say the
exactly.
right thing. That's all.
All right, number 7, trying new positions or mastering the classics.
I don't know. I'm a pretty adventurous. I would say probably trying new positions, I
Try new
guess.
fun stuff. New fun stuff. Number 8, would you rather always have to use medical terminology when talking about sex or only be able to explain things using awkward euphemisms?
Oh, I'll probably use medical terminology.
I wonder if that would ruin the mood at all a little bit
Yeah.
if you get real specific about that. All right. Okay, 2 more. Would you rather have to personally test every new sexual health treatment before recommending it to patients or only be able to give medical advice through interpretive dance? Are
Oh,
you a dancer?
dance. I could dance.
Oh, there's nothing you can't do.
Yeah. I don't know. I mean, I wouldn't mind either one, but I would say, like, just for fun, interpretive dance. Why not?
Interpretive dance would be kind of fun. All right, number 10. Would you rather be known as the doctor of desire or the maestro of men's health?
Um, Maybe the maestro of sexual medicine, just because we treat men and women in our
Yes.
practice.
Oh,
So,
that's true. That's a
so
good title. A maestro of sexual medicine. That's kind of good. That's an Instagram handle right there, I think. Well, I love having you, Dr. Gittens. Thank you so much for joining me. If there was any little piece of advice that you could give to the listeners, just something small to tell them before we go, what would you tell
Yeah,
them?
just, I think, in terms of sexual health, I think, have fun with it. And if there's
Mhm.
any sexual problems, I think that, find somebody in your area that's an expert.
Mhm.
If you feel like you're being closed out from, one of your physicians or anyone, then it's always somebody out there that's willing to listen to you. I
Yeah.
think you just have to
Find
find them.
someone new.
Yeah,
Yep.
that's, and just
Psychotherapy.
like, I just think you just got to move on. Just like,
Mhm.
people are so upset when they come in, like, the doctor said this, and they keep going back to the physician. Just move on. Just like,
Yeah.
just find somebody else.
Great
That's,
advice.
yeah. So
Yep.
that's what I would think.
Awesome. Well, thanks again for joining me and to the listeners out there. I hope you really enjoyed this conversation. He has so much insight on all of this. So please check out his stuff and you can find his website. I'll have everything in the show notes. If you enjoyed listening to me, you can find me on any major streaming platform and you can find me on Instagram and TikTok at from.mrs.2.ms. You guys have a great week and we'll see you next week. Bye.